All right. Hello, everybody. Dr. Chris, Pittsburgh Chiropractic and Wellness, coming to you live again. I said last week I was going to try to go live more often, so I'm trying to stick to it. And this is the second week. Hope all of you enjoyed the video last week. Today I want to talk about headaches. It's something that a lot of us struggle with, a lot of us have, and it's something that's when we go through it, they can be chronic in nature. So when you go through these types of headaches, hopefully some of the information I'll give you today will give you tips on how you can avoid it, what you can do naturally to get rid of these headaches. There's a couple different headaches that a lot of us may have suffered through. Most common ones are tension headaches. Those are the ones that happen typically throughout the work week. They come and they just feel like they're in the back of your neck. They go to your temples, and those are tough headaches to go through on a consistent basis. Migraines are another very common form of headache. Cluster headaches are very severe headaches. That's another more common one. And then the fourth one it's called a medication overuse headache, and those are the four most common types of headaches. Individually, after the tension headaches, migraine headaches, they produce a lot of inflammation, especially within the blood vessels of your brain, and they hurt. And one of the reasons why I love to talk about headaches is I was a headache sufferer. I still am from time to time. I had migraine headaches as a kid, very young in my early, I can remember when I was 7, 8 years old. They continued on to my teenage years into college. So let me know my story when I went to college and how bad they got. They stink. And migraine headaches, for true migraine headache sufferers, until you've had one, you really just don't know how bad they are. If you have a true migraine, your day's done. You got to go home, go to bed, turn the lights out, because you really can't function. I see a lot of headache patients in the clinic, and I can always relate to them because I've had a chronic issue with them. They've been corrected ever since got out of chiropractic school. I don't really get migraine headaches any longer, but I'll get tension headaches sometimes. And when I do, I have natural ways to go over how to correct those naturally. The cluster headaches. Cluster headaches get mistaken a lot of times for allergies. Cluster headaches go behind the eyes. When you get cluster headaches, they come in bunches and they don't feel good. They're very severe. They can be 9 out of 10, 10 out of 10 in pain. And then the medication overuse headaches, I'd like to touch on as well. So medication overuse headache is for those who are taking medication to prevent headaches. They're taking medication they get prescribed over the counters. Some people live off Excedrin migraine. Tylenol PM is another common one. Advil, Aleve, these are all common over-the-counter medications that we have access to whenever we want. But when they get real bad, a lot of times doctors will prescribe various medications, some corticosteroids to help with the inflammation I was talking about with the migraines that come. Other docs will prescribe Botox. They'll do Botox injections in various parts of the face to help with inflammation. They will help with, they'll also prescribe things like Maxalt or Topamax, which are just very, very strong medications. They come with very strong side effects as well. And then pain meds. They'll prescribe pain meds with this. And all those medications do it. I'm not judging because I've been there. But those pain medications, all they're doing is they are just masking the symptom. So if you have this headache, and if we can get rid of this headache by taking an Excedrin migraine, and it goes away, then we like to tell ourselves we fixed that headache. We didn't. It's the same thing as when your check engine light comes on your car, and instead of addressing the engine, you just put a piece of black duct tape over top of it and cover up the light. That light is still there, and until you address the underlying cause, you're going to continue to get those headaches. They might be more spread apart, they might come and go, but until you get to the underlying cause, you're going to continue to get those. So a couple of things with the underlying cause of headaches. They come from physical components, they come from emotional components, they come from chemical components. Hey Ryan, how you doing, buddy? Hey Howard. So with physical components, what we look into is prior history, car accidents, concussions. I played soccer as a kid growing up. Back in the day, we could head the ball as soon as we were able to. Now they have since restricted that. You can't head a soccer ball now until you're upwards of 11 or 12 years old. Did you play contact sports as a kid? We look into other traumas, ski accidents, prior history such as that. Those are all macro-based traumas, large-based events. Now you look into micro traumas, things that you do consistently over time that are on a lower force of things, but that happens to have a macro component to them. So what do a lot of us do throughout the day? Right, we all have one of these. We text, and we have that forward head posture. A lot of us are on a computer right now. We're sitting at a computer 8 hours a day. We're on a cell phone, pinching it. Okay. Go home and watch TV, same position. So that macro component over time produces one of those macro issues as well. So you look into your posture. What does your posture look like overall? I always use my father as an example. He's super kyphotic. He's rounded, forward head posture. Okay, that produces a lot of pressure on the neck, on the upper back. That did not happen over the past 5, 10 years. It developed over time, over the past 30, 40 years of poor posture with various other ailments. So you look at your posture, look at yourself right now. How are you sitting? How are you standing? So that's one of the things I look into in the office. Next thing you want to look into before you start taking a bunch of medications, right? What you at least want to know what the actual cause is. So there's testing that can be done. I always like to say I don't like to guess, I like to test. So things you can get checked. You can get checked with your B vitamin levels. A lot of times your B levels can be off. They can be producing headaches. Your magnesium is another level you can get checked. You can look at your magnesium levels, see where they are at. Vitamin D, you can look at your vitamin D levels and see where those are at on your blood work. So those are three pretty good indicators before you start taking supplementation, whether it's magnesium or a B2 or a D3, to know where your levels are at so you know how to supplement correctly. Blood pressure is another one. Stage 1, stage 2 hypertension, when you increase blood flow to your brain, typically it can be exercise-induced headaches. You increase blood flow and then you can get a headache the next day. Look into your resting blood pressure. We all know the standard number is 120/80. We want it to be below that. Are you hypotensive? Are you hypertensive? Where is your blood pressure at? When's the last time you've had it checked? You also look into your eyes. A lot of times we get, especially migraine or cluster-based headaches, I'll have my patients, they have not had an eye exam in the past year. You want to get your eyes checked. Staring at a blue light like this computer emits or a blue light like the TV will emit over time can produce headaches. So you look if there's any type of eye strain. And last but certainly not least, you also want to look into your neck. Cervicogenic headaches are a very common form of headaches. It comes with a lot of neck tension, upper back pain. And when you get this tension, those muscles in your neck, they all attach into the base of your skull. So when those muscles contract and they shorten, that inflammation will produce what's called a cervicogenic headache. That can be a stress-based headache as well. So there's a series of x-rays you can get of your cervical spine to see exactly how your neck looks. What science has shown us throughout neurology, especially within your cervical spine, your upper portion of your neck, those nerves, wherever they start, they don't start and end in your upper cervical spine. They go up into your brain. The first nerve in your neck, that goes to your brain. Second one goes to your eyes. Third one goes to your ears. So when we evaluate headaches, we want to look into exactly what the structure of that portion of your neck looks like. Now, if it's good and it looks clear, then we can rule that out. But a lot of times it doesn't, just because of the type of posture we have throughout the day. If you have little kids, you're bent over looking at the little kiddos. If you've had a baby, you're bent over in this position. I have 2 little ones now, so you're sleeping in precarious positions, and you're in that position where you're looking down a lot of the time. So that's some of the testing you can do. And last but not least, as well, as I didn't bring up the dental aspect to it, when you sleep, and if you're married, if you have a girlfriend or boyfriend, if they ever tell you that, hey, I can hear you grinding your teeth, there's a condition called TMJ. And that condition called TMJ, whenever you're clenching your jaw at night, that pressure can produce a headache as well. So next time you're at your dentist, if you do suffer from headaches, they can evaluate the back portion of your mouth to see if you're grinding, and they give you a mouth guard at night if you are, to help stabilize that and help correct that type of displacement of your jaw. So it's the last place you can look. So that's a couple other tips you can look for testing. Next thing I want to go over is what you can avoid. There's a lot of triggers that are out there that come from various stresses, whether it's emotional stress we touched on, chemical stress. And a chemical stress, there's a lot of it out there. Some of the things you can avoid, some of the things you can't. Chemical stresses come in the forms of various things, and I'll go through a pretty quick list. Staying away from things like alcohol and caffeine. Alcohol is an inflammatory substance, and it also dehydrates you. It also has a lot of sugar in it. If you drink a wine, for you wine drinkers out there, red wine and white wine, it's all great. You know, as we know, it's made from grapes. Fair amount of sugar in there. Sugar will produce inflammation. Inflammation can produce headaches. Caffeine is a double-edged sword. If you do suffer from headaches, you want to reduce your caffeine intake. On the flip side, if you're getting headaches, if you drink a cup of black coffee during the active episode of the headache, it can help decrease the headache tension. So you want to decrease your caffeine as much as possible. I had a consult earlier this week, and the gentleman, he's here for headaches, said, "How much caffeine are you drinking? How much coffee?" I said, "I'm only drinking about 3 pots of coffee in the morning." So let's work on cutting that back. So if you're a huge caffeine, taking a ton of caffeine, you're getting headaches, scale it back. Also, what you want to avoid, artificial sweeteners. They are tried and proven to produce headaches. What types of sweeteners that are out there that are going to produce these types of headaches? So anything that says diet or sugar-free, that's how you're going to know something has an artificial sweetener in it. Aspartame, something else called acetylflame potassium. When you go out to eat, pretty much anything in the middle of the table outside of pure sugar is going to be a natural sweetener, or an artificial sweetener, I'm sorry. Crystal Light, a lot of patients a lot of my patients will come in, they'll be hydrating on Crystal Light. They think it's water. Crystal Light has an artificial sweetener to it. Coke Zero, Diet Pepsi, so on and so forth. So if you're drinking any type of sweeteners or diet sodas, diet drinks, you're getting headaches, eliminate them, give it a couple weeks and see how you do. Aged cheeses like Gorgonzola is another trigger. The research is still out on chocolate. Some docs will say, get rid of the chocolate right away. It's not kind of completely been proven yet, but it's something you can do an elimination diet on. If you are eating a ton of chocolate, you can decrease that amount of chocolate, see if that helps decrease the amount of headaches that you're getting. Other things outside of food are fragrances. A lot of times when patients have very, very severe headaches, they are very susceptible to various types of perfumes, deodorants, sprays. So if you're putting on a fragrance and you're getting headaches, try to go fragrance-free to see if that helps decrease your headaches as well. And last but not least, is something else you can work on, which research is still coming out on it, but you can decrease gluten. We know gluten produces inflammation. Gluten is in a ton of different foods, but it's a good option, and I've had really good results of getting patients off of gluten as well as other foods in their diet to help decrease the amount of headaches that they're getting. So if you're eating a lot of gluten, you can also eliminate that from your diet as well. So that's what you can do to avoid. Now, what can you do to work on correcting this? Now we kind of have a list of things you can stay away from. We know some triggers that are out there. Now you're getting these headaches. Now you're like, I've been to docs. I'm sick and tired of being sick and tired. What's up, Dr. Ben? And what can you do now to decrease these headaches? So first and foremost, regular sleep schedule. So it's kind of comical, you know, with me having a 7-month-old and a 3-year-old talking about a regular sleep schedule. Having a regular sleep schedule has been proven to help decrease the amount of headaches that you've gotten. The Ohio State University did the largest sleep study that's been out there, and they followed patients around to see exactly how much sleep you need, when you need to go to bed. And so 2 things they found out is that 8 hours is still what they recommend, and they say never go to bed on the same day you wake up on, meaning past midnight. So if you're able to have a regular sleep schedule, that will help reduce the amount of headaches you have. Someone like my brother-in-law who works on 3rd shift, he hasn't had a regular sleep schedule for years. It's just the nature of the beast. So there's obviously limitations to that. But if you do have a regular regular work schedule, then you try to go to sleep very close to the same amount of time each day. Get rid of the TV an hour before you go to bed. Try to read a book instead to help decrease that amount of blue light that your TV emits. Exercise is next. Typically, I recommend high-intensity interval training, but the problem with high intensity is it's going to spike up your blood flow. If you're a chronic headache sufferer, we want to keep your impact down to a lower level. So keeping your impact down, from whether it's a brisk walk, you can do cardiovascular activity still. You just want to keep it down where you're not really crushing the high intensity until you get the headaches under control. Soft tissue massage works. You could do cervicogenic-based headaches. Softer deep tissue massage can help decrease the amount of tension within the neck. Do you as well. That's a big one. It's stress management 101. I've been teaching stress management for 15 years. And the first and foremost is we always put ourselves last, regardless of what it is. We tend to just give, and we really never take any time for ourselves. When you're under a lot of stress, you build up a hormone in your body. It's called cortisol. It's your stress hormone. And if you never get those levels regulated, when that cortisol level elevates over time, it can produce headaches. So if you can decrease that cortisol level, one of the ways you can do it outside of exercise is you can also do it by doing stress management techniques, by doing something for yourself every day. I love to play golf, although I stink at golf. I still love to do it, so I try to do that as much as I can. If you like to go bowling, hang out with your friends, go shopping, whatever it is, you try to do that once a week, and you do you every single week. You can also, on the flip side, I call it a 20-minute timeout. Once a day, whatever it is you like to do, take 20 minutes and do that each and every day. Some of you have dogs you might like to walk. When I get home from work, I'd love to put my son to bed. I fight my wife for it, but it's just something that I look forward to at the end of every day. It's like the best part of my day to go home and put him to bed. And every day I make sure, we read a book, we hang out, talk about the day, and that's my stress reliever. Two other things is hydration is key. When you're dehydrated over time, those are going to produce headaches. So dehydration, the rule of thumb, it's half your body weight in ounces every day, and you can't change water. You can't sweeten it. Water is water. So if you have what you need to drink, it's clean, pure water. And last but also not least, if you have not had your neck checked to see if you have what's called subluxation or misalignment in your upper cervical spine, first you have to get the neck checked. Once it's checked, okay, if there is an issue, you work on getting that corrected through adjustments to your spine. And there's various doctors of chiropractic that specialize in this. Others do not. Just like not all orthopedic surgeons are the same, neurosurgeons are the same. Everybody has their own specialty. So there's doctors, chiropractic doctors that specialize in spinal correction, and that's what you would want to seek out, someone who specializes in the correction of the spine, not just kind of a pain relief type doc. So when you're searching through that, if you're going through those types of headaches, you want to get that part of your neck examined, make sure you see someone who specializes in spinal correction. So those are things you can do. If you're getting a headache now, some quick tips before I get off of here, how you can get rid of these headaches, kind of things you can do if you have a headache, like I need to react to it, what can I do? So a couple of tips, you have pressure points, the real common ones in your temples. Another Chinese acupressure point is in the web of your thumb. So if you go through an active headache, the web of your thumb, it's not the soft tissue here, it's deeper in there. When you apply pressure in there, if you're having an active headache, it hurts. So if you keep pressure in the web of your thumbs for about 2 to 3 minutes per side, it will help dissipate the amount of tension that you have and can help decrease the amount of tension that the headache produces. Hydrate a big glass of water. Once you have your chiropractic doc on speed dial, go in and get adjusted. And then you can ice as well, 20 minutes on, 40 minutes off. You're trying to decrease inflammation. Ice your neck for 20 minutes. You can do that once or twice, and that will also help. Stay off your phone, stay off the TV. It'll decrease the amount of blue light. And those are some quick tips you can take home with you. So I hope some of this was informative to you. Once you get tested on those things, whether it was the B levels, your vitamin D, magnesium, you can then add those into your supplement regimen. But I wouldn't just go in blindly and take those, but you would also supplement with those things daily, and that will help decrease, hopefully, the amount of medication you're taking on a consistent basis, whether it's the over-the-counter meds from the Advil, Tylenol, etc. So hope you found this informative. I'll see you next week. Feel free to pass this on. And who else on here? Hey, George, I'll see you later. Hi, Miss Lynn. Hey, Aaron. And hey, Dan, been a while, buddy. So catch up with all of you soon. Any questions, throw them in the comments section. I'll get to them as soon as I can. Have a blessed week. Bye now.